Professional athletes are prone to torn rotator cuff, which can cause decreased range of motion and strength in the shoulder joint. The pain due to these injuries can often cause professional athletes to watch from the sidelines as their body properly heals. Today we visit Dr. Michael Meow, sports medicine orthopedic surgeon, to tell us more about torn rotator cuff injuries.
Rotator cuff is a collection of four muscles that come from the shoulder blade and surround the ball of the joint by attaching a sheet of tendon around the ball. It helps to hold the ball in the joint and helps to move the arm in space. Rotator cuff tears are actually a tear of the insertion of the tendon to the bone. Rotator cuff tears occur differently in different age groups. Younger athletes typically develop rotator cuff tears with blunt injuries, with the exception of overhead athletes like throwers, tennis players, who will get rotator cuff tears because of the repetitive injury. Older athletes develop rotator cuff tears as an attrition to the tissue over time. The pain is typically at the side of the shoulder and extends down the side of the arm into sometimes the elbow or the hand. The treatment for rotator cuff tear depends on the degree of the injury. A small partial tear of a rotator cuff can be treated conservatively with medications, injections of steroids, and physical therapy while resting the shoulder joint for a period of time. A more significant tear will probably end up requiring some type of surgery, either to remove torn tissue or to repair the tendon attachment back to the bone.
Rotator cuff repairs surgically is the most delicate repair I can think of to the shoulder. The biggest danger is to re-rupture that repair. It's a very delicate tissue in the beginning. Can easily be disrupted if you lift too heavy, if you do the wrong activities. So you have to pay attention to what your doctor and your physical therapist says. If there is some tightness in the joint, one exercise that you could possibly do, we can demonstrate, we're going to cut to right now. It's called the sleeper stretch or internal rotation stretch. This is a good place to start because sometimes it's so painful to lie on your shoulder that you can't actually get on top of it. So as you notice, Dave is kind of angled off the shoulder a little bit, and the arm is not quite up to 90. It's like halfway, about 45 degrees away. And you're going to take this hand, and Dave is stiff right there, so he's going to feel a stretch right there, right, Dave? In the back of the shoulder, and you want to hold that position for 30 seconds on, 30 seconds off, and you want to do it 4 times. And you can accumulate during the day. If you do it 4 times during the day, you can accumulate about 15 minutes worth of static stretching to the posterior soft tissue structures of this left shoulder. Now, when you get more advanced, you might want to take it a little bit higher up to 90-degree angle. Do the same thing. And now Dave is going to lie directly onto the shoulder and then do the same stretch, and you feel a good pull in the back of the shoulder. If you've been released and your physician is giving you the okay to go start using weights, then we have 2 exercises that are excellent for strength training the shoulder and protecting that rotator cuff, hopefully not allowing it to tear again. One of those is external rotation, and the other one is horizontal abduction. We're going to cut to those right now. So you're going to put his elbow on his knee, and we're going to slowly lower it down, controlling the fall, and then come back up. So that's external rotation, right? And goes out to here, and he slowly lowers it down, doing the eccentric loading to these posterior muscles back here. And again, we want to find a weight. We can do what? 5 or 6 or 8 times. Progress to 2 sets. We progress to 3 sets of 12 or 15 max. So 3 sets of 15 is max. If you can do that with no problem, you drop back down to 6 or 8 and add more weight. Always challenging the muscle to build back stronger. When we exercise, we tear down muscle, we want to build it back stronger.
Keep these tips in mind when you prepare for sports and want to stay strong and healthy. I'm Molly Sullivan with SportsMD.com. Remember, at SportsMD, health equals performance.